I'm Sandra. I'm going to be your dental hygienist for today. How are you?
Good, how are you?
Good, thank you. So before we begin treatment, I'm just going to go over like your health history and any questions, concerns that you have, okay?
Sounds good.
I am just going to start with a quick blood pressure and then we'll get started with your health history. Okay, so have you done your own? Okay, perfect. Everything is looking good. It looks like it's 114 over 75. So that's nice and healthy. And then I am just gonna take your pulse, okay?
Mine, I think you know it.
Okay, that also is looking good. 72 beats per minute, and your respiration is also doing good. 14, so that's perfect. Okay, I'm just gonna go over your health history here with you. Are you seeing a physician?
Yeah, I am. I was recently diagnosed with epilepsy.
Okay, and then are you taking any medications for that?
Yeah, I take gabapentin and carbamazepine.
Okay, and then when was the last time you had a seizure?
My first one was like 2 years ago.
2 years ago? Okay, is there any triggers or like why your seizures start?
Right now, I think a big trigger is just like the stress and the fatigue for me.
Okay, how are you feeling today?
A little bit anxious for the dental treatment.
Okay, well thank you for sharing that with me. Since you do have epilepsy, we'll try to keep your appointment short and comfortable in the mornings as well. So yeah, let me know if you need anything. And then we'll also keep all of the emergencies placed nearby in case, okay?
Sounds good.
Okay, so we're gonna go ahead and get started with some x-rays, okay? Hey, Steffi? Code blue! Okay, I'm gonna let you go.
Is everything okay?
Yes, please get the doctor. She's having a seizure.
Okay, I'll go get the faculty and the dentist and the emergency kit and the oxygen.
Okay, thank you. I will lay her on the side and I will be protecting her head.
Okay, help is on the way. I have a pillow for her. I will time the seizure and document the treatment.
Okay, thank you. The seizures? Hey, you just had a seizure. How are you feeling?
I think I'm feeling
You
okay.
feeling okay?
Yeah.
Okay, your vitals and everything look normal, but we are gonna have to dismiss you for today, okay?
Okay.
Is there anybody that we can call to pick you up?
Yeah, I think I can get my mom to pick me up.
Okay, we'll do that. Because the seizure lasted less than 5 minutes, we didn't have to call the EMS, but if it did, then we would have called 911, okay? But for
Okay.
today, you're okay. Okay?
Thank
And we
you.
would recommend that you follow up with your physician since you did have a seizure and just make sure that everything is looking normal with them as well.
Sounds good. Today we reviewed a patient with seizure disorder who takes gabapentin and carbamazepine. Stress and fatigue were triggers that contributed to the emergency. Seizures are a symptom of epilepsy, and gabapentin is an anticonvulsant pain medication taken for epilepsy and reduces abnormal electrical activity in the brain. Carbamazepine is also an anticonvulsant drug which stabilizes and reduces seizure frequency. These medications can cause xerostomia and drowsiness in the dental office, so it's important to keep these considerations in mind. When discussing their medical history, the patient explains that they have epilepsy characterized by simple focal seizures which are confined to a small area of the brain. These seizures can cause a tingling sensation in the area of the body such as the arm, foot, or fingers, which is why the patient could sense its onset before it occurred. During these seizures, people remain conscious and are aware of their surroundings.
As a nearby student, I went to get help immediately after hearing the code blue. I alerted faculty and the dentist and also brought the oxygen tank and the emergency kit. I made sure to have another student monitor my patient while I was away assisting with the emergency. During the seizure, we kept the patient safe and protected their airway. And I stayed by monitoring the emergency, and I was prepared to perform CPR or call 911 if the seizure continued for more than 5 minutes, or if breathing difficulties or unconsciousness lasted for more than 5 minutes after the episode. If the patient sustained injuries from the seizure, or if it were their first episode, I would call 911. Or if the patient were pregnant or had type 1 diabetes, I would call 911 also. I timed the event and recorded all of the events in the patient's chart and their notes, which were signed after the visit.
As the operator during this emergency, I discussed the patient's health history and medications before starting their treatment. I made sure that the patient was taking medications as their physician recommended and that their seizures were controlled. I made sure to call Code Blue as soon as the seizure began. I carefully helped the patient turn on her side, making sure she would not fall off the chair, and removed all the instruments from the area to ensure her safety. I positioned the patient supine on her side. Oxygen was administered 4 to 6 liters per minute. I did not forcibly restrain the patient or place anything in her mouth. After the seizure was over, we postponed dental treatment and dismissed the patient. The patient was also referred to her primary care physician. For prevention, during the next visit, I will make some modifications. Some treatment modifications include short morning appointments, stress reduction, and ensuring medications are taken as prescribed. We will try to prevent triggers such as anxiety or stress or bright flashlights. Medical referral is important when seizures are frequent or uncontrolled.